You've built a system that is so easy for the customer or for a person to use. Can you tell us more about that?
Sure, we call it, we intentionally do it, and we call it exponential simplicity, and we insert it everywhere we can into the process. And my wife tells me often that I'm very easily irritated and annoyed, and I don't tolerate it very well. So when we build a system and it breaks or somebody doesn't do what they're supposed to do, that's irritating and annoying to me. And so I'm always looking for ways to create some safe gaps so it can't happen. And simplifying in an exponential fashion is the way we do that. And that might be a little abstract, but let me give you an example. So if we think of just something in healthcare that's irritating and annoying for the purchaser and the user, the employees and for the employer, start with copays. There's a lot of things irritating and annoying, but let's just start with copays. Think about this copay thing. It creates no value for either of us. If I work for you, it doesn't create value for us, doesn't create value for my doctor, but we have this thing that nobody questions. But what if we got rid of it? Just do a mental exercise. Think of it as this big domino. What other smaller dominoes are knocked out because of the copay that we got rid of? Well, number one, we don't need a credit card anymore. We don't need a credit card machine. We don't need a merchant account, the bank account the credit card is tied to. Dang, we're not even taking checks or cash, so we don't even need the till drawer. And we don't need somebody to count the money and reconcile at the end of the night. And I don't even need a chair for them to sit on then during that time. And I don't need a manager to watch them. All these things have expense. Dang, I don't even need to send a statement anymore. Or one of those explanation of benefits that, our insurance companies tell us this is not a bill, but we sure look like one, which then costs money to somebody. And it also confuses people, which means now you call me and my customer service person has to answer the phone and I have to pay them to explain your EOB that's not really a bill that sure looks like one, but you get the picture. All the billing and the coding and the computers and the billing department, the legal department, the audits, the recoups, all of that accounting just goes away, it evaporates. But what would happen, think of this, if we left 1 penny there? We didn't make the copay 0, we made it 1 penny. All that would stay, wouldn't it? If we decided to make it minus 1 penny, we gave you a penny, all that accounting, all that work would stay. The magic here is 0. So if we can find what are the things that are irritating and annoying that create no value for the purchaser and user, and we eliminate it, not reduce it, but eliminate it, because its rightful place is at 0. That's what we've done over and over again. In some very common sense places that if we were really being honest with ourselves, are the exact same things that happen in every home where mom's a medical doctor.